Good morning, students. Today we will see about the health education. The health education is the very important question, and it is the backbone of community. This health education topic is coming under the education as well as in the community health nursing. So what is health? Health is a complete physical, mental, social well-being, not merely the absence of disease or infirmity. What is called education? Education is a all-round development, and also it is bringing the end result of the education, bringing the behavioral change in the individual. So about health education, this is a process by which the individual or the group of people learn to behave in a manner to conducive to promote and maintain and restore their health, or else it is a process aimed to encourage the people what to be in healthy, to know how to be healthy, and what to do individually or collectively to maintain their health or to seek the help whenever it is necessary. So what these two definitions are telling about us? These two definitions are telling about the health education is a responsibility of the healthcare people, also responsibility of the individuals to take their own effort to maintain their health, and also to ask the help whenever it is needed. So it is the individual responsibility, it is a collective responsibility of family members, also it is a governmental responsibility. So that is what my introduction and definition of health education. Anything you learn two definitions. How to learn the definitions? You just remember the key words, then you make your own definitions. Some few words are not missing, it's okay, no problem. With the concept you can write your own definition. What is the concept? Changing concept. Oh, before and all, health education means you will teach and somebody will listen it, only that. No, nowadays the changing concept means it's an idea, isn't it? So what is this? Is a main four things I have given about the changing concept, what they are telling about the changing concept. Before and all, only prevent the diseases. Now prevention of disease to promotion of the health. Prevention of disease for the vulnerable people, also who are healthy, they have to be healthy, to continuously to be healthy. That is the promotion. And modification of the individual behavior to the social environment. How with the social environment? So the societal involvement, individual behavior will influence about the societal behavior. So if you want to educate the school child, this school child will go and educate their family, the family will be educate to the neighbors will be changing and following, so whole society will be educated. Then community participation to the community involvement. Participation means you are the participating, but involvement means you will be involved to do it. Correct or not? But without participation, no involvement will come. If you are the NGO, or if you are a NSS people, you are going and always collecting the dust from the people in the community, they think that, oh, we throw, some students will come and NGOs will do that. What you have to do, you have to ask them, oh, come on, it's your house, we come, we both will clean your house. So they participate. Once they participate, they are getting involved. Once they involve, their behavior will change. Next day they will not put the dust in the particular place. They think that I also have to clean, it is my responsibility. The behavior and attitude is changing. That is the main concept of health education. Then the promotion of the individual and community to the self-reliance. So once I take my dustbin, I put it myself. I don't expect for somebody to come it. I can segregate the dust into two. I can recycle it by myself, rather rely on somebody will come and take it. So that much behavioral change in the health education makes the people to be self-reliance. What is the aim? Aim is an important aim of health education. What is the aim of health education? First, the health education encourages the people to the healthy lifestyle. What is unhealthy lifestyle? Eating pan parak, eating alcohol, drinking alcohol, smoking. This is a unhealthy lifestyle. What is the healthy lifestyle? An example, maybe exercise, walking, stress-free life, sleeping, correct healthy diet habit, etc. So you have to encourage as the healthcare professionals and help to utilize the healthcare services. Nobody will be aware of it. Oh, there is a vaccine. There are the people coming. This particular day vaccine is given by primary healthcare center. They may not be aware of it. Once you go to the home visit, make aware of it. Many schemes, 101 schemes been announced by the government, but nothing will be reaching. So you can make an make an arouse the interest about them. See, these and all is there, so many people are benefited, so you tell them, it will create an interest. So to arouse the interest, to improve the knowledge and skills, and to change their attitude is the behavior. So once you tell, they started to do that one, to promote the self reliance. All these things will be made to self reliance of this one. So this is about the aims of health education, correct? Next is the principles of health education. This is often will be asked these questions in the paper. So what I thought is, I thought of giving you some mnemonics so that you will be remembering. MGR pickles FL, yes, you can put it. So MGR pickles FLC you can put, because otherwise will be wrong. Okay, one C is missing. Okay, let us see what is MGR pickle. M is called the motivation. What is motivation? Motivation creates an awareness. Awareness creates an interest. Interest creates an participation. Participation creates an involvement. So what you have to do? You have to motivate. The motivation is the first important principle. Then first is a good human relationship. So what is good human relationship? First, immediately you should not talk with the way you do, change. So no, like how are you? How about your health? How is your family members? What you celebrated? How you have to make a good relationship, make and trust with you, that then they will have a, you will be a credible person for them. Then they will respect you, and then they will accept your health education. Reinforcement. Whenever you are making a good human relationship, you have to repeatedly tell, see, this is not good, this is good. For example, when I am taking class, I used to tell the students, you do not know there is a gold medal is there in this question. If you write it again, this will be a gold medal, you will get it. So that you have to tell them, like how you to avoid. See, you are taking a water from the pond and drinking. Again tell, okay, I know, I can understand there is a problem. So first what you do, it store the water and filter the water and boil the water. Again reinforce them, then their health will be preserved. They will not develop any waterborne diseases. And then participation, I gave you an important examples in participation. Whenever you do the healthcare services, make them to participate. Don't only the service approach, you just make them also clean their environment, correct? And then interest, it should be in a interest, like whatever you are telling, it should be interesting. How to create an interest? Many time when I am taking class, my class may not be much interesting, means I tell some stories, success stories, some failure stories. It creates an interest. See, like that one person was affected by DP, but he went to the clinic, he improved, he ate a good diet, the TB is vanished, and he is living long. You can tell, and within this one, that is what another one also telling. It's set an example, so and so, my neighbor or my this one, the real story you tell them. Setting an example is an effective principles of health education. Then known to unknown. What is known to unknown? Because many people are diabetic, right? You go and tell, diabetic is disease, blah, so and so you are telling. Just ask them to say, what do you know about your disease? They will really tell you, because they are master of their disease. They will Google it, they do it. So after hearing that, yes, excellent knowledge you have, and I tell you something, you change the slippers and do the foot care. I will demonstrate to you the foot care. Teach them, this is how, because you can prevent from diabetic neuropathy. The nerves will be affected in future. So always you check your, do foot care and check your foot. They will be very much happy, right? And credibility. The person who is giving must be a credible person, must be respectable person. And feedback. Feedback is an essential thing of the any communication, or in the like health education. Health education is a kind of communication, right? Okay. So the feedback is an essential part. What is called feedback? Feedback, how this work is essential. How do I take your feedback, my class feedback? I ask you question, you may answer it. How do I see the feedback of health education? My health education, I may ask whether they boil. I told 101 time reinforce to boil the water and drink. So next time I go to the committee, if I see they really filter the water, boil the water and drinking, their behavior is changed literally, right? So I see that their behavior changed and the diarrheal disease in that area is reduced. That is a good feedback, right? That is the called feedback. So the feedback is an essential of communication. Leader, who is the leader? Leader means it's not a big person or the politician person. No, leader is the person who can influence others. If you go to a village, some people will be one lady maybe will be there. She is the one. Any child is affected by something, immediately I called that old masi mama. She will do everything. So you call them. She is the leader. So you go and see those people when you are new. This she will be influencing the other people. So she will introduce you to the other people. Oh, Masi told Masi is a good person. So then through her you can get the good rapport and your health education will be more effective when you take leaders. Correct? Okay. Then what is this? This is called approaches of health education. This what is called approaches. So many time the I told you the end of health education is the behavioral modification. So sometimes always you are telling slowly, they will not listen. So sometimes if you take in Indian population, nearly 7 lakh to 10 or 20 lakh people are dying in the road traffic accidents. So sometimes you tell that you wear helmet, don't give the vehicle to the children or kids, don't encourage them, they don't listen it. So in that time regulation should be necessary. Regulation is nothing but law and order. You put a law and order. If you not wear a helmet, okay, we will collect money from you. That approach will be sometimes will be better to change the behavior of the people. Correct? Then health education approach. What is health education like? Health education is a process where you go to them and teach them. This health education approach may be any method, like a home to home method, or through WhatsApp you are making an awareness, or creating one videos, mass media. Anyhow you conduct those approaches, that also will modify the behavior. Next is the service approach. That literally was a failure approach. 1960 in India there was anemia rate is very very high. They thought that they found out the root cause analysis why the anemia is very high. They thought that they found out that because of the hookworm infestation. Why the hookworm infestation coming? They found out the root cause analysis. All the people go for the open field defecation. So open field defecation, when they go, the worms are going and cross. It is there, and through the vegetables are there, and it is ate by the pig ate by the man, or the cow eating that, and many cycle it is coming. So what they thought is, they thought that okay, what we will do is, will door to door they will go. There is a Rockefeller one foundation came forward to build a toilet. So they take a pilot project and they took on a village. What they have done, voluntarily gone and nearly spending 10,000 rupees each house, they build the toilet. Okay, the health education must be the feedback we have to see, why that toilet built, so that they will avoid defecation in the outside. But feedback is essential, right? I told you in the principles. After 3 months they went to the Rockefeller Foundation. Anemia rate was not reducing, so they went and opened the toilet and see, they were very much surprised. They have put and locked all the unwanted material in that, and they used as a storeroom. It was really pathetic. So this was not there. This was a failure approach. Why it was a failure? Because it was not a felt need. Currently, what is the felt need? If you tell you are giving some money for the vote, it is a felt. Money is a felt need. If you see the serial in the TV or the movie, that is a felt need. People are not feeling that. There was a no felt need was there. That was a great failure approach. Then another one is a primary healthcare approach. What is this primary healthcare approach? Every 1 is to 20,000 or 1 is to 30,000 population, they open up the primary healthcare center. They created any problem you are there, you come to the primary healthcare center, either the vaccination or the COVID or the diarrhea, come. So this is also a one kind of a approach, primary healthcare approach. So what is called primary healthcare? Primary healthcare is an essential healthcare, universally accessible, acceptable by the people with the country and the cost which the country can afford it. So primary healthcare will be differ from India, it different, and it is from the US will be different. Primary level care we are giving, but they will give in a primary health care, it's a tertiary level care, admitting, calling, or many things. It's according to their finance condition we are fixing this care. Correct? Okay. Let us see what is this. What is this? I told us scope of health education. What is the scope? We have seen scope of nursing, community health nursing, right? Through health education, what I do? You can write by your own thing. Through health education, anything you can give. Even sex education you can give, dental health you can give, nutritional service education you can give, mental health, dental health, environmental health, how the diseases are spreading, physical health education, how to make your body clean and other things you can, emotional health education, sexual health education you can give, first aid you can give, prevention of accident for the children, toddlers, and road traffic accident, n number, anything you can write, you will get a mark. Either this question may be 5 mark, you can elaborate few points you can write inside, correct? Yes. Next is called the this is the already I told you how this motivation creates awareness, awareness creates interest, interest creates participation, participation creates an involvement making the success of health education, correct? Okay, what all we are telling, how you will conduct the health education. So how you will conduct, so what is the approaches you will do? It is will be like an individual approach, group approach, mass approach. Individual approach means you give a lecture method, home to home you will visit. Group approach means group health education, flashcards, discussion. You will do a mass method, you will make a pamphlet, you will make a video, you will send it through WhatsApp, Instagram, Facebook. All these called the newspaper, news, many things. It's called the mass, this one. So this is the important about the important chapter in nursing. Either you are a MSc nursing or BSc nursing or diploma in nursing, this question always commonly will be asked next to primary healthcare question. So it is a very important one. You have to thorough. What is you have to thorough about it? What is the definition? So two definition you will be remembering. Then you will remember about the changing concept of health education, aims of health education, principles of health education, MGR, Pickles, FLC, then scope of health education, and will be the approaches of health education, and how to conduct, methods of conducting health education or approach to conduct the health education. Approaches is different and approach to conduct health education is different. Correct? So all the best. You will do good, I believe. So next class we will see about how to organize a health education in a village. Thank you.